Lindsay, you've come back again. This is your stamina is quite incredible.
I know, I can't get enough, John. Great.
Thank you. Now, the reason we wanted to talk again is I know you're doing a project on immunity at the moment.
Yes.
But before we do that, I mean, you mentioned you're a pharmacist, which is great. I mean, do you think pharmacists have much of a role really in this pandemic, or are they kind of side players, do you think?
No, pharmacists have been on the front line since day one of this pandemic, before we even knew how much of a threat this virus was. And they were working, they didn't have plexiglass barriers, they didn't even have PPE, right? And pharmacists were showing up day after day after day, and they were working really long hours. There were huge backlogs. I think the pharmacists have kind of been the unsung heroes of this pandemic. So they've been on the front lines. I haven't seen one pharmacy close during the pandemic. Have you, John?
No, I haven't. No.
No.
Well, it almost sounds like you might be quite useful people then, pharmacists.
Well, I would hope so. Yeah, I would hope so. We've, we show up for our patients. We like to see them healthy. And I know pharmacists that have been working really long hours because, in large part, or sometimes due to even medication supply issues, where they're just scrounging to get, at the beginning, to get, the right supplies of medication for their patients. And I think they're really accessible pharmacists, right? So you can just walk into your pharmacy and speak with the pharmacist. You can't do that with your doctor.
You can just walk in and start chatting, can't you? It's brilliant.
Yeah, you can't. Yeah. You can't. And you could just walk in and speak with your pharmacist. I know my pharmacist, over here in the neighborhood, I could just go and speak with him, right? And they have a lot of information. I know that they were a real go-to for a lot of people when all of this started.
So what's the training to be a pharmacist? Do you do a 6-month course or something?
No, to be a pharmacist, you have to do, it's usually a 4 to 5 year university degree program. It's quite intensive, and we know a lot about anatomy and physiology, how the body works, different disease states. And pharmacists know a lot about medication. That's our job, and we do dispense medications. Some people think that we just count medication pills out and just kind of give it to you. But we look at different interactions. We look at it, whether this medication is appropriate for you, whether this is the right therapeutic indication. And we can also speak with your physician and kind of try to optimize your therapy. So I think it's definitely an essential role that pharmacists have to play.
Yeah. No, pharmacists are proper scientists, aren't they? That's the whole beauty of it. This is a science-based discipline.
Yes, it is.
And I don't know what it's like in Canada, but quite a few places now we have pharmacy consulting rooms.
Yes.
So you can actually have a private consultation with the pharmacist if you, and more or less on demand, and.
Yeah, that's one of my favorite things to do, is sit down with patients and talk about their medications and make sure. There's a lot of patients that are taking medications, they don't know why, and they don't know what they're for. And sometimes they were prescribed something maybe 10 years ago, and maybe it's not even effective for them anymore. And, if they go in and talk with their pharmacist, we could really, optimize things and hopefully improve their health.
I've actually done some teaching on programs where we're training like registered nurses and pharmacists up to do the extra diagnosis and treating.
Yes.
And basically turning senior nurses and senior pharmacists into general practitioners, really.
Yes,
it's a whole untapped area of expertise, or largely untapped area of expertise.
Yes, and in Canada, we're starting to be able to prescribe for minor ailments. It's kind of rolling out slowly, but I think it's something that's essential. You don't need to go to your doctor necessarily for.
Yeah, we have a whole program of non-medical prescribing. Yeah.
Excellent. It's very forward thinking. It needs to happen.
Yeah, absolutely. So this immune strengthening program that you're working on, that's quite intriguing, because what a lot of people don't realize is immunity comes in not only just to protect us against viral and bacterial illnesses, of course, but there's so many abnormalities of immunity. Type 1 diabetes, for example, is an autoimmune disease. Crohn's is an autoimmune disease where the immune system goes wrong. And I believe that, we know scientifically, that a good immune system is necessary to prevent many types of cancer.
Yes.
So you can have immune surveillance against cancer as well.
Yes.
So immunity is absolutely pivotal. So what sorts of things have you been discussing that can improve immunity, or at least optimize the immunity we have?
Yeah, so something that I think is a discussion that needs to happen, that has not been happening really before COVID-19 and now during COVID-19, is the state of our overall health. and how, there are very easy ways that we can help to strengthen our bodies and prevent these kinds of diseases before they become big problems, right? So I'm doing an immune series, and it's to, help you strengthen your
video
immune
series,
system.
Lindsay.
This is my video series.
Yep.
This is Friendly Pharmacy 5.
Yep.
And we are talking about an array of different aspects of immunity that you can actually control somewhat at home. So I'm not saying that this is going to prevent you from getting COVID-19 or virus or anything like that. But for instance, sleep. Sleep is very important to your immune health. Inflammation is another factor. How can we reduce inflammation? And vitamin D is something that I'm talking about. I'm talking about omega-3 and different vitamin deficiencies. Being a pharmacist, I know that some medications can cause different vitamin deficiencies. And so discussing that, talking about herbal remedies that are evidence-based that can be of benefit. And also, again, talking about polypharmacy, so where a person is taking a large amount of medication that is maybe not necessary or not beneficial to their health. So that's something I'm talking about in this immune strengthening series.
Now, is it okay if we play your sleep video after this?
Yes, for sure. I hope you enjoy it.
Obviously, we'll put the links to that as well. So
it's helpful.
So you're actually saying that sleep is important for immunity?
Absolutely. Absolutely. There's a lot of hormonal regulation that happens during sleep. We know that sleep is important. Well, it's important for memory, but it's also important for the body to repair itself during sleep. And a person who is getting, it's one thing if you don't sleep well one night. That's not what I'm talking about. I'm talking about the chronic issue. And insomnia is an epidemic. Insomnia is a huge issue. And just taking a pill for it is something that maybe short term can help you. But if this becomes a longer term thing, this can definitely leave you more prone to disease. And even if you do get sick, you might not be able to battle that infection as well as you could have if your immune system was functioning at a better level. So
there's a whole raft of research on people working shifts long term as well on this, isn't there?
That's right.
Problems of
and
that.
Incidence of cancer and that kind of thing, for sure.
Yeah, it really is a big issue, and so people can watch that video shortly. Yeah,
sure.
What is inflammation, Lindsay?
Well, in medicine, we study inflammation as being, different sign that we see on the body, right? So, what are the four of them? It's heat, redness, pain, swelling, that kind of thing is how we can visibly see inflammation. But
so like if you twist your ankle, it's hot and it's swollen.
That's right.
It might be a bit...
And you can see that, and also has a very clear starting point and end point, right?
Yeah.
But there's inflammation that happens in the body that we can't see, and that's mediated through the immune system, and we see that in COVID-19. We talk about the cytokine storm and that kind of thing. And if we have a high sugar diet, that can increase inflammation in your body, right?
Can it?
And so it can. Definitely.
Any sugar, or some sugars worse than others?
I'm not sure about that. I think just the dietary, sugar intake, fructose, that kind of thing, that we see in these sugary drinks, can definitely increase.
We're just not designed to eat sugars, really, are we? It's just kind of not.
It's not ideal. I mean, we will get it. Eat fruits and vegetables, and you will get the sugar that you need. We really don't need all this added sugar and that kind of thing. So inflammation is a huge issue with immunity and chronic disease.
And do you think vitamin D is an immunological modulator as well?
Oh yes, and I think there's clear evidence for that vitamin D can definitely help improve your immune response. So it's something that I'm covering as well in the videos.
Fascinating.
It's essential, I think.
I think I'm going to watch these. I'm getting interested.
Thanks, John.
I think I'm getting.
I would appreciate it.
Interested already. Yeah.
Yes.
What is omega-3?
Yeah, so omega-3 is an essential fatty acid that we can get through our food. It's very high, or found in very high content in fish. A lot of people don't get enough fish from their diet, though. So it's something that, as a pharmacist, I do not recommend very many supplements. I see people wasting a ton of money on a lot of supplements, but I think that, vitamin D and omega-3 are ones that are quite essential. And omega-3 is very good for the immune system, but it also, interestingly, it does help to reduce anxiety in some people and depression, and that's evidence-based. So I think that there's a definite benefit, and there's a lot of people who are very anxious, and we've got mental health issues. And
do you think there's a lot of anxiety and depression in society?
Oh, definitely. And I think
it's a common problem.
That's been highlighted during this pandemic.
It's almost a universal problem.
I think it's a universal problem, but I think it's worse, and I think we're just seeing the beginnings of.
I've certainly had episodes of both. It's just awful, isn't it? I mean, yeah.
Yeah, it's a major issue.
I mean, how many people can you name that haven't had episodes of anxiety or depression? This is just endemic, isn't it?
It is, and it's something that's being discussed more and more, and I'm glad that it's coming to the forefront and we can kind of treat it. So I think omega-3 is kind of a more natural way of not treating depression. I'm not suggesting that, but I'm just saying that it could maybe help with mood and help with cardiovascular outcomes, immune outcomes, that kind of thing.
It's a real brain food, isn't it?
It's worth considering, for sure. Yeah.
And I think for vegetarians watching, it's important to know that you can buy completely vegetarian omega-3, because omega-3, we tend to think of it coming from fish, but fish do not make omega-3. It's the plankton that the fish eat that make the omega-3.
I did not know that, John.
Absolutely. Most of the omega-3 in the world is made by marine phytoplankton.
Okay.
And they produce the fatty acids, and all the fish do is concentrate it.
Okay.
So there's an increasing movement now. I think in Hawaii there's a huge farm for making phytoplankton, so you can actually buy the phytoplankton now as a kind of green powder.
Excellent.
Then you can mix it up with your yogurt and all kind of stuff.
Yes. Well, that's good.
Or you can buy capsules of omega-3, which is completely vegetarian, and of course that's good because it doesn't fish out the oceans.
That's right. But
it's exactly the same omega-3, because a fish is just an omega-3 processing plant. It's not an omega-3 factory.
Very interesting.
Just comes from the marine phytoplankton.
I didn't know that, John. Thank you.
Yeah, so check out that one, and vegetarians can eat that to the heart's content.
For sure.
Under the guidance of their
farmers.
Good option. No, it's a safe thing. It's a natural fat, isn't it?
Yep.
Yeah. Now the vitamins. I remember learning ADEK, A, D, E, and K are the fat soluble vitamins.
Yes.
So is it possible to overdose on the fat soluble vitamins?
Yes, it is. It is. So when we talk about vitamin A, D, E, and K, they are fat soluble, and they tend to they're stored in the body, right? So they are something that we have to be more careful with than say, I caution to say, but say a vitamin C or something that's water soluble, right? So we do have to be much more careful with these vitamins.
So what's kind of your thinking with vitamins and immunoprotection?
What is my thinking?
Yeah.
I think that there's definitely a place for them, but I think that they have to be used wisely. And I don't like the extremes of, taking, 10 grams of this or that. You have to be careful. And you definitely should be consulting a healthcare professional. So a pharmacist, you could just walk in and ask your pharmacist what would be a recommended dose for you, and go about it that way, rather than just taking random things in high doses because you heard that this thing is great for whatever. There needs to be a balance. So I think there's a time and place for sure.
Yeah. But I think the point is any nutritional deficiency can potentially compromise the immune system. That's the issue, isn't it?
It is. And I don't think that that's something that is addressed in traditional healthcare settings in general. Yeah. It's a conversation worth having.
Yeah. So it's not that taking extra vitamins is going to take my already hopefully good immune system and make it better. But lack of vitamins can reduce the efficiency of the immune system. I think that's what
right.
That's what
it can leave you more vulnerable and leave you more vulnerable to disease, and not just to disease, but to a more severe disease, more severe infection. Maybe that you're going to get the infection regardless, but maybe you're going to recover in 5 days instead of being sick for 10, right?
Sure.
So.
Sure. The other, I don't know what you think about this, but I think B12 deficiency is probably more common than it is really recognized, because we know if people are very short of vitamin B12, they'll get a macrocytic anemia, what we call pernicious anemia. And but I think if you get pernicious anemia, that means you've got really quite significant B12 deficiency.
Severe, yeah.
So whereas we know that B12 is again necessary for quite a few functions of the immune system.
Yes, and vitamin B12 is.
Sorry, I meant to say the immune system. Yes, what I meant to say then was the nervous system.
Yeah.
I mean, I'm sure it does play a role in immunity as well. And again, it just makes you wonder. There's so many psychological distresses that people have. I just wonder if that is a factor. I don't know how well that's been researched, because a lot of people, as they get older, can't absorb vitamin B properly, as you'll
That's
know.
right.
And this is the pernicious anemia B12 malabsorption syndrome, that people can't absorb it. And I just suspect that's more common than a lot of people realize.
I think it is, and there's a medication called metformin that's used for type 2 diabetes that there's evidence that helps, that does reduce the levels of B12 in the body as well. So some people who have type 2 diabetes and they're on metformin, it might be an idea for them to consider talking with someone about their B12 levels. It's
And yet, for people with type 2 diabetes, metformin can be very much a life-preserving drug, can't it?
Metformin is a first-line type 2 diabetes medication.
It's a great medicine.
Taking it. Keep taking it. It's very effective.
Yeah,
it's very effective. But there are some things that that there's some considerations that go along with that.
Absolutely. And so you mentioned other meds as well, Lindsay. What other meds are you concerned about in relation to the immunity?
Well, I was going to talk about metformin. Sometimes there's I see very readily prescribed sometimes anti-inflammatories, even topicals, that kind of thing. Different. I can't just think of any quite specific ones right now.
Steroids, of course, are going to be.
Steroids, and there's a time and place for steroids, right? There is a time that you need to be on a steroid, but sometimes when you've been on something for a certain period of time, maybe you're not getting follow-ups that often, and maybe that's something that needs to be discussed, because maybe you don't need to be on that for that long. The other thing is, proton pump inhibitors, so medications that reduce the amount of acid that your stomach produces.
So this is lansoprazole, omeprazole.
Lansoprazole, yeah.
Anything that ends in azole.
That's right. Well, I don't know, because then there's fluconazole, which is antifungal, but
good point. I've forgotten about that. Yeah.
But proton pump inhibitors are widely prescribed, and I see patients all the time. They've been on these for months or years, and I mean they help the problem in that they're decreasing the amount of stomach acid. But in doing that, sometimes we don't have the right amounts of vitamins, minerals, nutrients, that kind of thing being absorbed into the body. And so that's something that often proton pump inhibitors are something that I wouldn't tell people to get off of them, but it's something that, why am I taking this? Is it still working for me? Do I still need it? Let's have that conversation. So I'm covering that.
Regular reviews of medication.
That's right.
Is there any nutrients particularly that can be a problem with PPIs?
I haven't seen specifically a nutrient that has been depleted because of a PPI. But just not having that stomach acidity, there is some evidence that people may be prone even to infection with that more basic environment, right?
It's achlorhydria, isn't it? Well, in medicine, we call it achlorhydria.
That's right.
Yeah. Well, I started on lansoprazole a couple of years ago when I was working on A&E, and the week after I got rotavirus.
Oh, see.
GP just gave me it for a few weeks, and I got rotavirus the week after. So I'm blaming him.
I mean, if you have a bleeding ulcer, take it, it's if it's indicated, yes, but I think we have to think about there are consequences. We have, unfortunately, in traditional medicine or in medicine in general, we have no perfect cure for hardly for few things, right?
Yeah. No, the week after I got rotavirus, I had really quite significant gastrointestinal problem, shall we say, for a few days.
You had other problems, yeah.
Yeah, and then it was really bad diarrhea and stomach cramps, and then I was absolutely wiped out for about 10 days after that. I couldn't work for.
It takes a while to recover.
Yeah, so hydrochloric acid is good stuff.
It's necessary. There's a reason we have it. Yeah.
Now, this herbal stuff, what's the difference between herbal medicine and homeopathy?
Well, herbal medicine is based on it's herbs, it's botanical agents that can help the body as opposed to pharmaceutical agents. Homeopathy is a bit of a controversial topic.
I wouldn't say it was controversial.
It was a little bit in Canada. We did have some.
I'd say it's poppycock bunk and anti-scientific gibberish from start to finish.
Okay.
Just my personal view, of
course.
Sure.
Sure. Yeah. I don't think the evidence is there for homeopathy. And I think that it was a nice idea to, dilute something, a million times and hope that it's going to sensitize the body.
When you take no molecules of a substance, I don't think that's going to have a pharmacodynamic effect.
Yeah. I mean, maybe there's a placebo effect, but I don't think
for sure.
science-based. I wouldn't, if I had a pharmacy, I wouldn't have it in my pharmacy. So
the thing about herbal medicine is, of course, herbs come from plants, and of course they can be poisonous.
Yes, they can.
We think of foxglove leaves that people used to take for dropsy, which is the old-fashioned name for edema, and get the dose wrong and it kills you.
Yes, and medicine, everything is dose dependent. And just because something is natural doesn't mean that it's something that is recommended. And, so yes, herbs are, can be very helpful, but they can also be very harmful. And so it's something that you need to do. You need to be educated on this issue. You can't just go, growing things in your garden and taking copious amounts. And it's something that, I think that it's great that we have plants, we have herbs that can be really helpful in medicine. When I was in Brazil, we studied a little bit about the Amazon and the great things growing there. Interesting, right? But
very interesting.
It's also it's dose dependent and take with caution. I tell people say, this is natural, it's okay. I say, well, snake venom is natural. And would you like a dose of that? Right.
Crocodile saliva is natural, but it still causes infections. Yeah.
Exactly. Yeah. So.
No, snake venom is perfectly natural. You're quite right. Yeah. But so many of our medicines do derive from plants, don't they? So, I mean, you think of atropine, morphine, of course, comes from plants.
Yeah, digoxin was
all the opiates. Digoxin, aspirin was originally willow bark.
Yes.
I'm sure there's some more.
Yeah, and I think there's been great developments in that area, but it is something we always have to proceed with caution when we're ingesting anything or treating ourselves with anything.
The thing about herbalism, of course, it's hard to get a consistency of dose, but the thing is, when you're taking in a herbal preparation, there might be a couple of hundred different alkaloids from the plant, and the potential for these to have synergistic effects or interactive effects or beneficial effects are there theoretically. So I can definitely see the potential immense benefit from that, but you've got to kind of
to balance it, and you have to
get it right. Yeah.
I appreciate whenever people would come and talk to me at the pharmacy and ask me, should I be taking this and this? I mean, St. John's wort is a huge one. I mean, look at the interactions with that, and people were taking it, and all kinds of things were happening. So, we need to proceed with caution and let our healthcare providers know what we're doing, so we can assist.
Yes, St. John's wort does work as an antidepressant, doesn't it? There's evidence that
it does,
but it interacts with so many other things. That's the problem. It's and
the evidence for the effectiveness of it, I don't know if it's totally conclusive at this point.
Yeah.
So.
Yeah. And the last one you mentioned was polypharmacy. What's that, Lindsay?
So polypharmacy is when we have one patient taking usually about 4 or 5 or more drugs for one condition or for more than one condition. And we know as soon as a person is, and it's not uncommon, as soon as someone is taking more than 4 or 5 medications, the chances of them not taking it correctly or the chances of them forgetting to take it and that kind of thing becomes a big problem. And this is especially an issue with people who are, say, over maybe the age of 60, 65 sometimes. It's not uncommon for people to be on anywhere from 5 to 10 medications. And so polypharmacy is something that's a concern for pharmacists. It's something that we are very well educated on and able to assess. And we look at how these medications can interact, when would be the best time to take them. For myself, I love to see people not need to take certain medications, or just to be able to kind of assess, okay, maybe is this really helping you? And often, I'm not sure where you are, John, but in public health, we don't always have specialists talking to each other. So you might have 2 specialists, 3 specialists prescribing different things. You might be hospitalized at some point, and then you come back to the pharmacy, you've got this huge list of medications and all these different prescribers. It's like, what is going on?
Someone's treating the kidney, someone's treating the eye, someone's treating the heart, someone's treating the stomach. And
they're not looking at the big picture. This is polypharmacy.
Yeah, it's not looking at the holistic picture and the big picture. Absolutely, yeah.
Yeah.
Yeah. Yeah, we have a joke about the new orthopedic surgeon who's just started, who takes a holistic approach and believes in treating the whole bone.
Yeah, and I think there's a place for holistic medicine for sure, but you can't throw traditional medicine out, right?
No,
sometimes there is a place for it, and it's done great things for many people. Sometimes you do need an antibiotic or a steroid, but you need to be accompanied for sure.
Yeah. Lindsay, that's absolutely brilliant. I'm going to watch those. I'm going to put the links down. Should we play one now? Should we play the one on sleep?
Yeah, sure. Let's watch one. That would be great.
Should we do that?
Have a look. Yeah,
Let's do that now.
I love it. Okay.
As someone who has suffered from bouts of insomnia and difficulty sleeping myself, I know that sleep and getting a good night's sleep begins in the morning. I also know that insomnia is not something that is fixed overnight. It's a process, and we have to try to break the cycle of insomnia or sleep disruption. So as we go through the slides today, please remember that this is a process. It's one step at a time. Your sleep is not going to change overnight, but it can change slowly, one step at a time.
Collaborators on this video include Ashley Chang and Joel Churn, both from Vancouver, BC.
So as you can see from this slide, not getting enough sleep or difficulty sleeping is a very, very common problem in Canada.
Sleep can be divided into phases known as REM and non-REM sleep. REM sleep is associated with dreaming and memory consolidation. Non-REM sleep is associated with restoration, including increased blood flow, relaxation, repairs of the body, and growing tissues. Sleep is very important for learning and memory, brain plasticity and detoxification, body restoration, and enhancing immune defense. 7 to 9 hours of sleep is ideal up to the age of 64, and if you're over 65, 7 to 8 hours should be sufficient.
So what is the relationship between sleep and the immune system?
We can see that with better sleep, we have reduced infection risk, improved infection outcome, and even better vaccination responses. Sleep disturbances, however, lead to a weakened body defense system, increased risk for infection, and increases in inflammation.
What happens to our bodies when we don't get enough sleep? It's not just that we're tired. There's a lot going on internally that we don't see, but we do feel it.
Factors such as more sedentary time, chronic stress, poor mental health, and some medications can leave us at greater risk for some of these chronic diseases, which can also lead and be complicated by some of the more common sleep disorders.
Insomnia, restless leg syndrome, sleep apnea, and narcolepsy are common sleep disorders. If you think that you may be suffering from one of these disorders, please speak with your pharmacist or your physician. Your sleep is affected by many different hormones in the body that are responsible for many different things. We're going to talk about a few of them. I'm going to start with leptin and ghrelin.
I have no idea what leptin and ghrelin are.
Leptin is responsible for the feeling of fullness and reduces the desire to continue eating. Ghrelin causes feelings of hunger and is highest before meals. With a lack of sleep, we see increased ghrelin and decreased leptin, which leaves us hungrier and with less feeling of fullness after eating. One thing you can do is try to have a glass of water before you do need to eat something if you're tired, and that might just do the trick.
Next, we have cortisol and melatonin.
Cortisol has a stimulating effect which is highest in the morning and during periods of high stress. Melatonin responds to decreased light, increases sleepiness, and is highest in the evening. Blue light from electronics, some ceiling lights, and stress causes an increase in cortisol and a decrease in melatonin, which affects our normal sleep cycle.
So what are some of the complications of poor sleep?
When we're not sleeping properly, we have higher levels of ghrelin and decreased levels of leptin, which gives us less feeling of fullness and higher cravings for sugary foods, where we're more likely to overeat. On the other hand, we also have an increase in cortisol and a decrease in melatonin. This leads to poor quality of sleep, poor memory, and less repair of body tissues. These combined lead to higher incidence of inflammation, pain, risk of chronic illness, and susceptibility to infection.
So now we know that not having enough sleep has a huge effect on our bodies, including on our immune system. Stay tuned for our next video, where we'll give you some strategies and some tips on how to get a better night's sleep and how to break the cycle of poor sleep habits. If you've enjoyed this video, subscribe to Friendly Pharmacy 5 on YouTube or like us on Facebook. You can also join our Immune Strengthening Support Group on Facebook. It's free to join. There is no cost to anyone. This is being sponsored by a COVID-19 Responsive Neighborhood grant. This community support group is to help give you support as you strengthen your immune system with our video series over the coming months. On our support group, you can ask questions, you can discuss with other members what some of your strategies are, and there will be extra content there as well for viewers who are looking for more information. When you're ready, you can proceed to part 2 of our immunity and sleep series. We hope to see you there. Bye-bye. Many of us need to be on our phones at night for whatever reason. So if you are going to be on your phone or another screen in the evening, what you can do is you can change and program your device to switch onto night shift. I have my phone programmed at 7 p.m. Something you can do to kind of trick your body into becoming sleepy in the evening is to reduce the use of ceiling lights or ceiling lamps. What you could do is you could use a side lamp or bedside table instead. That helps to simulate the sun setting and could kind of trick your body into producing better melatonin levels in the evening.
Diets low in protein can also reduce levels of tryptophan in the body, which are essential for the production of melatonin.
Beta blockers are medications that are used for heart conditions and arrhythmias. Beta blockers can reduce the amount of melatonin that the body produces. If you or someone you know is on a beta blocker and is having trouble sleeping, maybe tell them to have a conversation with their pharmacist so their pharmacist can guide them and maybe help them get through this issue. We can practice something called sleep hygiene. Sleep hygiene refers to good habits that we establish throughout the day to ensure that we can have a better chance of having a better sleep that evening.
Go to bed and get up at the same time every day. Go to bed only when you're sleepy. Remove screens from the bedroom. If you cannot sleep after being in bed for 15 to 20 minutes, get up and go to another room to read. Avoid exercise within 2 hours prior to bedtime, as this may interfere with sleep.
Can't forget that electronics are not just a problem and an impediment to our sleep. There have been many advances, and we can now use electronics as something that can actually help us sleep. I'm going to go over a few of them with you now.
Sleepio is a sleep app that is used widely in the UK and now covered by some Canadian benefits providers. Very exciting news. We contacted the makers of Sleepio, and during COVID-19, they have agreed to give users immediate, full access to their apps using the following links. You heard it here first. Another app is called Sleep Score. It is microphone and speaker based, so there is no need for it to be worn or placed on a mattress. Headspace is a relaxation app. It is helpful for relaxation, meditation, and mindfulness, with a sleep aid section as well. My Noise is a white noise app where you can create sounds to your taste for sleeping. Calm is a meditation app that also provides breathing exercises and sleep stories.
Of course, there are some over-the-counter sleep aids, as well as prescription sleep aids and supplements that may help you to get a better night's sleep. Always consult your pharmacist before taking any over-the-counter medications or supplements.
Many over-the-counter sleep aids are made from diphenhydramine, otherwise known as Benadryl, a common allergy medication that needs to be used with caution, especially in the elderly. Melatonin and valerian are sometimes effective. Many herbal medications lack sufficient evidence for insomnia and need to be used with caution.
Zopiclone is a prescription medication that used to be widely used. It's now known that Zopiclone can interfere with memory. It can also cause complications in the elderly. If it's used, it should only be for a short time and in a very limited dose. And yes, some of your prescription medications could be interfering with your sleep. Here are a few examples. If you are on any of these medications and having trouble sleeping, ask your pharmacist if they could be the sources of your disruption or your difficulty sleeping. Thank you so much for joining me. Remember, Rome wasn't built in a day, and your sleep is not going to change overnight either. Maybe tonight you could just start by going to bed 15 minutes earlier and maybe using a table lamp or a bedside lamp instead of ceiling lights. These are small things, but small things have a big impact. Remember, the better your sleep, the stronger your immune system. So this is something worth paying attention to, one step at a time. Thank you so much. Bye-bye.